Ladies and gentlemen, dear friends, it's a big honor for me to have been invited to this prestigious meeting. And particularly, I want to thank Professor Britta Engelhardt, who is an immunologist and who has chosen to give some room to rehabilitation and symptomatic treatment of multiple sclerosis. So I'm going to talk about cannabinoids, and actually I will try in my 25 minutes to answer the question you might ask yourself. Is it the value, is it a real, or it's just in the heads of our patient? There's not so many drugs which are so controversially discussed as cannabis is. And maybe you know this slide, you know this lady who was a British queen, Queen Victoria, and she had very bad menstrual pain. And the only drug which helped her at that time, that was to take some tincture of cannabis, and her doctor, Sir Russell Reynolds, wrote in The Lancet, a very prestigious journal at that time, that it is the best thing one can have. So 100 years later, things were a bit different because people were saying, well, actually, it's not fair to give to our MS patient marijuana because it's bad for them, and one exploits their naivety because they are helpless. So that is another issue. Then there is a true, and I get always telephones from MS patients saying, well, my doctor doesn't want to give me cannabinoids, although Sativex is on the market. So you can ask yourself, why was I, as a young neurologist, in this beautiful clinic in Montana? Actually, I'm retired, but anyway, I make some publicity. Why did I be interested in this plant? So it's a very nice story. There was a patient, as a young patient, he had severe spasticity, and actually we tried all the drugs we had at that time, Valium, even Valium and Lioresal, and it didn't work. And so finally I asked him, well, what does help you really? And he said, well, the only thing which is good for me, I smoke a joint and then I feel good. So we, with my colleague, Dr. Roots at that time, the patient smoked his joint, we examined him beforehand and afterwards, and we were just amazed to see how much his spasticity had gone away. He moved freely and he made a few steps. So this fantastic experience remained in my head, and 5 years later I had a bankier who said, Dr. Wanne, you know, I have read on internet that cannabis could be helpful for my spasticity. Then I said, it's illegal, I can't give it to you, but I can ask the Office of Public Health. So I wrote the Office of Public Health, and they told me, no way that you can get cannabis for this MS patient, but it was Mrs. Dreyfus, who was the president of the Confederation at that time. We will give you money to make a study. So I got the money, and but I was somehow kind of helpless. I looked at the studies which were done at that time, so very few studies using THC and MS, but one guy, Professor Brenneisen, I happened to go to school with him, so I phoned him and said, could he help me to design and to create this study? And so we managed to do one of the worldwide first studies on cannabis on multiple sclerosis, and we used for this some drug which was in form of a capsule that is not as a spray like today, but it was an oral form, and this capsule contained the two main components of the drug, that means CBD and THC. So I have to do a little bit of pharmacology. The plant, the cannabis hemp plant, contains about 60 different cannabinoids. And you have on the slide the THC, that's the one which makes high, the psychoactive part. But this same THC has other properties. You can use it as antiemetic. Sometimes young children going through cancer therapy have very bad vomiting, and we know that it could be helpful against this. And you see the other properties, and all the ones who smoke a joint, they know that afterwards they get very hungry. And in the drug, there is also the component called cannabidiol, which has other property, which is not psychoactive and has also anticonvulsive properties. And maybe some of you who are neurologists, you know that there is some kind of Selden syndrome called Dravet's, and there are studies showing that there it could be helpful. And it's also anxiolytic, even in patients with psychotic illnesses. Sometimes you can use pure CBD. Anyway, just that to show you that the plant has a good mixture of these two items. And the Sativex, which is on the market, has this harmonious combination of CBD and THC. And the key point is that the CBD, which is in the spray, that attenuates the psychoactive property of the pure THC. Another little opening is you have to know that all of you who are sitting here, you have not only cannabinoid receptor in your brain, and these cannabinoid receptors are very important for the communication of our cells. So if one cell is stimulated, and in the synapses you get this communication, and then the electric current goes further. And if the cell is too much stimulated, it has to defend itself. And it will defend itself by producing endocannabinoid. So this is a very subtle mechanism in our brain, in our central nervous system, like cannabinoids work. So this was so much for psychopharmacology. Back to our study. And we measured 50 patients. We measured Ashworth scale, which is a rather objective measure of spasticity, and showed how the patient under Verum did, and looked how the patient under placebo. And you see it was not significant. That means objectively we couldn't find any difference between spasticity measured with this Ashworth scale. However, a spasm protocol, nurses went 5 times a day and asked the patient, how you feel, how is the pain? And there was a significant difference between the two groups. When we published it, of course, the editorial they published it, but the editorial was rather not very positive, and said that probably all the patients we put in our study, they were just high, and that's why they appreciated actually their lessened pain between these rosa-rote Brillen. Okay. And even in the newspaper in Wallis, they were making fun of us. That was not very serious, the work which was done in this clinic in Montana. Nevertheless, I was invited with 2 of my assistants to go to Los Angeles, because we were some kind of the first in the world who did such a study with so many patients. And today it's really banal, because now every doctor in Switzerland can write and prescribe cannabis if he has the allowance with Betäubungsmittel. So just this, how it works in Switzerland. So basically, if you have a patient with MS, it is enough that you take the special recipe for substances, narcotic substance, also Betäubungsmittelrezept. You write Sativex, and the patient can go to the pharmacy and get it. In case you want to give him some tincture, that is a solution if the patient doesn't want to have the spray and prefers to have some tincture, so you can also order it. But then you have first to write to the Department of Public Health to get a special authorization. Usually you will get it if you say why you do so. On the right side of the slide, you see also the prices, and it costs roughly about 10 francs a day, 10 to 20 francs a day if you want to treat with cannabinoids. So back to multiple sclerosis, make it short. You know, of course, that it is a progressive disease, and probably in 50% of our MS patients with about 25 years, their mobility will be reduced so that most of the time they will be in real wheelchair and sitting at home. And what is a particular interest is how these people feel. And one thing which already Professor Kesselring talked, there's a problem of mobility, that people feel that they are a burden for their family and that they can't go from one place to the other. Then, of course, they are suffering from, 60% are suffering from spasm and spasticity or tingling pain, neuropathic pain. And then the third aspect, already evoked by Professor Panek, is the problem of bladder, the incontinence and imperative bladder problems. So these are the three major issues if you look at the quality of life of our MS patient. So in the last century, it was perfectly illegal to consume cannabis. And you see from different statistics here, and Canadian, but also British, 10 till 20% of patients suffering from MS tried illegally to consume cannabis. So why did they do so? It could be that this is a wonderful molecule, and this could be the answer to all their illness. So if you were to create a perfect drug for multiple sclerosis, how should this drug be? So it should slow the progression, it should have no serious side effects, it should be not too expensive, and it should affect on the different symptoms of multiple sclerosis. So which are the symptoms? It should lower spasticity, it should reduce pain, it should calm the bladder, and increase mobility. So we are going to check if this plant can fulfill these requirements. Can it slow progression? So the best thing to slow progression would be to have such a pool. So you can go to Lake of Lucerne and throw you in there, and you will not gain your youth again. So this is a middle-age idea that there is some kind of fontaine de jouvence that doesn't exist. But on the other hand, we know that cannabinoids we know that probably cell degeneration goes through glutamate, and cannabinoids seem to reduce this excretion of cannabinoids. We have another study with mice, and if these mice do not have receptors for cannabinoid, they will, if they get EAE, they will be doing very badly because they can't recuperate so well. And finally, there is a study where they gave an antagonist to the cannabinoid receptor, and this lady developed a multiple sclerosis. And finally, in the SideCheck study, that was the biggest study with over 600 patients, it is interesting to see that the relapses in the 6 months were found only in the persons which were taking placebo, but not in the ones which were taking THC. And seeing these results, the English, who are not very, they don't like to spend money on their health system, but they made a big study, the CUPID study, where they hoped that they could influence the course of multiple sclerosis by giving to their patient cannabinoids. And we are waiting of the results. So I could show you that cannabinoids had the property to slow down progression. What is it about side effects? If you read the different articles which were published at that time, most of the authors say that cannabis was well tolerated. There were not many serious side effects. And as I told you, in the SideCheck study, even it was interesting to see that the patient on cannabinoids had no exacerbation, but the ones on placebo did. So, and in our study, it was interesting to see that people were asked many times every morning, well, do you feel high or not? And as many as people who are taking just tap water or tablets containing nothing, they were saying that they feel high, but they didn't take the substance. And you see that the other side effects were quite similar. So when you talk about the difficulty or dangerosity of a drug, one has always to think about these little spiders, Indian spiders. And you see, if you give this spider LSD, they are not working very well. If you give them mescaline, it's not bad. They are doing quite well on cannabis. And what you just take for 5 minutes ago, coffee. So you see, this is a dangerous drug and not so dangerous as cannabis. And the whole thing about schizophrenia, of course, people who are some kind of biological predisposition, of course, giving them THC is not a good idea, but you can't be schizophrenic by taking cannabinoids, at least in the ones which you have on the market. The problem is that it is tolerated to have THC of about 1%. This on the left side. And what is dangerous? Because it's an illegal drug. So people grow their cannabis in their cellar and with a high light, and they have THC content which are between 20 and 30% with hardly any CBD. And this is called skunk. And of course, if you take such a street THC, then you will be very bad. So this is the dangers of being still an illegal drug. So I could show you that the side effects are not so serious if you have this proper drug. Low cost, it's clear that it costs 10 to 20 francs a day. Cheaper it would be, and the Germans are ahead of us. They just decided 1 week ago, the Bundestag decided that it will be possible for patients in Germany to get THC Blüten, that means the flower, and to have it much cheaper than to have it when they take the THC as Sativex. So I could show you low costs. Let's check the symptoms. So you have, for instance, muscle spasm. Usually you use these drugs, but they have all the side effects of doing weakness. And of course, you will ask yourself, how does it work? And you see a little mouse which has some kind of spasticity. And you see every time somebody pulls the leg, and then it goes back. This is very spastic. And now you give this little mouse a bit THC, and you see the spasticity has just been blown away. Because it's so nice, I show it again. This is because the mice beforehand with this spasticity, and then with the drug, it goes away. So that's so beautiful. That's why I show it again. And now it reduces. All the studies looked at spasticity. Once again, they asked the patient, how do you feel about your spasm? Here you see that it was always improved. In our study, we could also show from the moment the patient were taking the drugs, their spasticity level was diminished. And probably there was a beautiful American drug where they gave their patient smoked cannabis, which is much more effective, of course, than tablets. And here you see that even the Ashworth scale, which was in our study not sensitive, the Ashworth went down. So does it reduce pain? I just cite this ROG study, visual analog scala. Here again, you can show that the spasticity is in a visual analog scale. The patient taking the drug feel better. And this study made that the Canadian government already 6 or 7 years ago licensed Sativex as one of the first countries in the world. Does it reduce pain? Here again, you have some studies where you have a significant reduction of pain. Does it calm the bladder? Professor Panek has already talked about it. And here we have one study which shows that the urgency is diminished, less incontinence episodes. And here again, another study showing that the reduction of imperative or difficulty of the bladder was much more impressive than in the group taking placebo. Increased mobility, here, SciCheck study, they measured the walking time over 10 meters, and you see the speed was higher of the persons which were on the drugs. And everybody thought, well, if you give cannabis to people, they will be completely stoned in the corner. And this is just not true. And in our study, we could also, with a mobility measure, show that cannabis improves the mobility and does not the contrary. And even in a big study, Italian study done with the Sativex, you see that stride length, walking speed are improved thanks to it. So in summary, what would happen if this lady I introduced in the beginning of my talk would take some cannabis? It's like Alice in Wonderland, and she goes, and in this wonderland of cannabis, she will be mobile again, and she will have hardly any bladder problems, and finally, actually, the pain will go away. So, actually, I could end my talk. I have proven to you that cannabis is just a panacea. Unfortunately, I have still 4 minutes left, and so I have to apologize because I just led you astray. I just showed you nice statistics. That's why statistics are that you can cheat with them. So the real story is that they followed up the patient in the SciCheck study, and they could show that actually in the 6 months, the people didn't do any exacerbation, but when you followed up another year, there were the same number of exacerbation in the ones taking THC and taking placebo. We hope that the CUPID study, which was done, would show us that the progression of the disease is reduced, but it didn't show you so. And actually, the people who are taking the cannabis and the other, unfortunately, the disease progressed exactly the same way, and John was very sad about it, but this is a reality. So, and if you look at spasticity in other studies, you could not feel that the spasticity went away and that the persons were still very stiff. It was not significant. When you look at our study, we had a high dropout rate, 12%, and very often we had to reduce the drug because the people didn't feel good. Finally, there is, since Professor Calabresa talked about brain, there is of course a concern that MS patients with cognitive problems, they might have more cognitive problems when you give them, or you have to be careful about it. In my years in Montana, I had the opportunity to record all my patients who were taking THC, and finally I made a telephone call and tried to look which were still taking grass, of course illegally, and which had stopped. And most of the time, 1/3 had stopped, and when they stopped because it didn't work, because they were dizzy, tired, so it is probably not a drug which can be always useful. And the British, in the NICE guideline, they say that it is not a cost-effective substance. Of course, I have to say 2 words on Sativex because this is on the market. And there's the big study they did. They found out first in a Probelauf of 4 weeks to see which were the responders, because not every patient responds. So they look which are the responders, half of it are the responders, and then they examined the responders. One continued on THC and the other had placebo, and there you see a significant difference. But first of all, they had to select the one which really respond to the drug. So I think we should not throw the baby, we should be Swiss compromise. And what should I think? The American review has shown that in a systematic review, yes, it works on spasticity, it works on central pain, and it works on urinary dysfunction. And there is another, the Swiss government financed this huge meta-analysis where they said there was a moderate quality evidence to support use for treatment of chronic pain and spasticity. So my approach is very pragmatic, and it was the same as Lou Metz in the Lancet when the big side-check study. I think it is in our job is to look after our patient, look if we can do something about quality of life, and there is this substance which sometimes can be helpful. So I have not answered this question, is it real or imaginary, because this is your job and you can do that while drinking coffee. Thank you very much.
Thank you very much for this excellent talk. Are there any questions from the auditorium? Maybe, meanwhile, I can ask you, you used a capsule, today it's a spray. Yeah. What's the rationale for using a spray instead of a capsule? The company
didn't do it anymore because it's a very, to do the spray, the Sativex, that's why it's so expensive. You have to have big fields, you have to control the quality, you have to be sure that you have always the same THC level. And probably this is a price problem, and that's why probably they abandoned the oral. And it is the bioavailability is when you take a cookie, only half of it you will use and the rest goes to the toilet. And the best is to smoke it, so if you want to have an effect, but it's illegal.
Are there any other questions?
Mm-hmm. Yes. What is your experience of cognitive impact, especially in the medium long term?
Yeah. I think there are two levels. If children, before they go to school, which they are 13 or 14, and they smoke, it's not a good idea for them. If a 60-year-old lady makes her tea in the evening to have less spasm, so if she is not quite clear in her head, it doesn't matter.